While health experts, nurses, and doctors continue to try to get control of the coronavirus outbreak, the larger issue is looming, the healthcare fallout. Joining us now to discuss is healthcare analyst and author of The Cure. That's Seth Denson joining us now. Seth, good to see you here. There are various facets of the coronavirus, right? We look at it from a healthcare perspective, a medical crisis, if you will. But then there's also this, the healthcare fallout. Kind of explain this to us. What does that mean? What's happening that maybe that's not getting a lot of attention right now?
Well, a couple of key things I think that we need to make sure that we understand is that underlying health conditions in the United States haven't stopped just because coronavirus has expanded. Cancer is still an ongoing problem. Heart conditions, diabetes, everyday accidents and illnesses are still out there. And so the underlying challenge that the healthcare community has is how do we continue to manage those challenges, which keep our hospital systems at about 65% capacity nationwide. Some metropolitan areas more so than that, along with the coronavirus and the looming challenge of not only our facilities, but our healthcare providers.
I want to ask you this, too. New York City now the epicenter for coronavirus, as we know, with how many we're testing and now how many are infected, how many deaths were happening. Governor Cuomo spoke about this yesterday as how it's spreading faster and harder. Take a listen, and I'm going to get your reaction to this.
The federal government has to prioritize the resources. Look at where the problems are across this nation. California has 2,800 cases. New York has 25,000 cases. New York has 25,000 cases. It has 10 times the problem that California has. We need the federal help, and we need the federal help now.
Okay, Seth, what's your thought on this? Because Cuomo is asking for more federal assistance. He wants more ventilators. He wants more hospital beds. He wants more staff workers to come to the city. Is he correct in saying so? Also, is it because we're having more testing done in New York City that we're seeing these increased numbers? I just want to kind of get your thought on that.
Yeah, I think it's a combination of two things. One is, yes, we are seeing more testing being done, but two, you also have a highly populated citizenry that's very concentrated. And I think that's an ongoing challenge as well. And while I sympathize with the governor's position, and in some ways he's right, we absolutely, from a federal perspective, need to make sure that we're sending resources where they need to be most. Governor Cuomo is the chief executive of his state, and he needs to also do all he can and should have been in the process of preparing for this just as much as everyone else. And it's easy to Monday morning quarterback this, but we all need to work in alignment and work together. We shouldn't take away from one to give to another unless it's absolutely necessary, but let's make sure that all resources that are available to those that need them the most, both at a state and federal level.
Seth, we hear a lot about PPEs, personal protective equipment, and that we hear that we're short. We don't have masks. We don't have respirators. How much truth is there to this? We hear a lot of reporters in the White House asking this question. How many masks are you sending? How many PPEs are you sending? Are we really short on this, and why?
Well, one thing to be clear of, and I want to make sure we point this out, the federal government doesn't run the factory to establishing these PPE products. Private manufacturers do, and to their credit, they're stepping up. Just this morning, the CEO of 3M, I watched an interview and listened to him talk about how they're partnering with other manufacturers like Ford and some of these others to make sure that they're mass producing other products on a faster level. And so I think there is no limitation to the amount of products that the federal and state governments are trying to both acquire and get sent out. It's our ability to manufacture these. And I think when all this is said and done, and it will end at some point, these are the things that we need to make sure that we're addressing for future coronavirus challenges or ones that might be like them, is how in a pandemic are we best set up to manage these. But one last thing I'll say on that is I'm really encouraged to see private innovation and studies step up. Just this morning it was announced, or we were reading where they're finding ways to reuse masks and PPE products and maybe sterilize them appropriately. And this is when American ingenuity and innovation comes to light. And I'm absolutely thrilled to see that as a component of what's going on here. But it addresses the bigger challenge that we need to take care of once this is settled.
Yeah, a lot to be learned from this. Seth Denson, healthcare analyst and author of The Cure. Seth, good to see you. Thanks so much.